So welcome to Tree of Life. And today we're talking about the wonders of women's health. And today our guest is actually Antoinette Erskine. She is actually a women's health advocate, and you're going to hear some really wonderful information from her today about women's health. I do want to tell you that this information that we share with you today is for educational purposes only. You may have some specific questions or conditions that you really should seek medical advice from your doctor regarding those things. But today, as you listen in, there may be some nuggets that you will take away to help you to live a better, much more enriched life as a woman. We know that in the Bible, it talks about the virtuous woman, of all the many things she does for everybody. You can find that in Proverbs 31. But today we're talking about taking care of you, the woman that God made, and how you can care for your body, your mind, and your spirit as his temple. Welcome, Antoinette. We're so glad you're with us today.
Thank you for having me. I appreciate it.
Oh, we're glad you're here. So just tell me a little bit about you. And I know you have a mission for women's health.
Yes. So, as you've heard, I am Antoinette Erskine. I am a women's wellness and feminine health educator and coach. My background actually didn't start off that way, but personal issues and family members dealing with a lot of reproductive health anomalies is kind of what led me down this path to women's health. Myself, I dealt with really, I guess what a lot of people might even think normal, but they were unhealthy menstruation, and I couldn't figure out what was going on. My doctors weren't really helpful, and so I started doing a lot of research on my own. I had a family member who has succumbed to breast cancer, but she was told by physicians and her gynecologist, just take out your uterus, it'll be fine. Um, Conversations like that just led me to think that there's no way God gave us all these body parts. Things are falling apart. They're just telling you to take it away. Everything is fine. Take this medication. You'll be fine. And he didn't design, I believe that he didn't design us in a way to just take this magic pill. He gave us the knowledge, the information, the herbs. Um, he gave us everything to take care of ourselves. And so it led me down this path, which I ended up getting my master's in health and wellness coaching. So here I am.
So that's awesome. So what you have to share with us today is really going to be some really awesome news. The first message that I heard you say is that we must take ownership of our own health. So there's times that the doctor or medical professions will give us advice or maybe don't give us advice. And we really need to really connect with information, whether it's through a person, books, research, anything of how to connect with that. So tell me a little bit about some of the things that you have done. You actually kind of gave an overview of actually how you got on the journey, but tell me exactly some of the steps that you've taken since that you started the journey.
Well, the first thing is always research.
Mhm.
Of course, Google is a friend, but beyond Google was a lot of books because, of course, with Google, most people know that you'll read one thing and then you diagnose yourself and you're going crazy, right? But for me, it was really understanding the why. Like we see the symptom, we see the outcome, but why is this happening? And so instead of targeting the symptom, I was looking for the yellow brick road that took me to the why of all of it. And so that's kind of how it started. So for me, it was, it might be a little TMI, but this is something that a lot of women experience, but I was bleeding through my clothes every single cycle. I was not diagnosed with fibroids. There was no diagnosis. I was not on any hormonal birth control, none of that. But no one could tell me like why, and bleeding to the point where I would pass out.
Oh.
Okay, so when I tell people I've experienced it, but why is this happening? They're giving me iron pills because they're telling me that my iron is low.
Mm.
And if you know, iron helps to oxygenate the blood. And if you don't have enough oxygen, your hemoglobin is low, and then I pass out.
Mm.
And so they're giving me all these iron pills. Nothing is happening. It's not working. I'm not getting better, but there's no answers. So I'm looking for alternatives to help build the oxygen in my blood and my hemoglobin. That was what I was doing instead of just trying to stop the bleeding. This is the source of the lack of iron and hemoglobin. I'm going to that. So that's kind of how it started for me. With my aunt, when she was diagnosed, her physicians had advised her to go to more of an organic diet. So here in America, organic diet is a thing. You go to other countries, it's just a way of life because a lot of their foods aren't processed. And if they are processed, they're not processed with a lot of these toxic chemicals. And mind you, this is back in the 90s.
Mhm.
So we're talking, my family has been shopping at Whole Foods for well over 20 years at this point. Um, but really taking note of the kind of foods that we're eating. If you're a meat eater, making sure you're eating really good, unprocessed, organic, natural meats.
Mhm.
Same thing with your eggs. If you do, eat meat products, making sure that it's quality products. And I think that's one thing that a lot of people overlook is the quality of their supplements, their foods. It matters. Yes, it might be cheaper to walk into Walmart and buy a thing of magnesium, but the quality. So those are the things I started paying a lot of attention to, was what I was putting in my body, the quality of it, but finding out the why. Since I wasn't getting that help, I needed to know why this was happening.
And I think that that is actually the big question mark, why is it happening? In fact, your story reminds me much of the story of the woman in the Bible, the lady in the Bible who for years and years and years went to doctor to doctor to doctor, really kept trying to find out the why of what was going on with her body without great success. And I
Yeah.
think that God has given you the knowledge and the desire to share knowledge with others about the why, and let's help understand our bodies, really understanding our bodies, paying attention to our bodies. I like that you mentioned that what we eat has a direct influence in our body. And so the quality of food, I think we cannot underestimate the quality of what we put into the body will affect how the body functions. And so I think that that is amazing that you help kind of really decipher and just kind of go layer by layer, if you will, and begin to say, what is it that's happening inside the body that's causing it to respond in this way? So you've helped many people on this journey of health and wellness.
Yes.
Tell me a little bit about that.
So everybody's journey is different. One thing I want people to understand is because we're different,
Mhm,
because while we might have the same disease,
mhm,
the approach still might be different because one, your lifestyle,
mhm.
um, food choices. Some people are allergic to certain foods. Some people don't like certain foods. So there's no one one size fits all. Is that
Yes.
how they say it? There's no one size fits all for anybody's journey, but it's really understanding like what's your goal. Some people, their goal might be to have a baby.
Mhm,
So that path looks completely different as somebody who just wants to have a healthy menstruation.
mhm.
Or it might be the woman who is perimenopausal, which a lot of us are, or actually in menopause. That path looks completely different. So really understanding those stages as well is equally as important because the body has different needs. And so making sure that whatever we discuss fits those needs based on the time, your age, your chronological age. Because while you might, like right now, I am in a perimenopausal stage. However, I um, have other issues that
Mhm.
need tending to. So I also have to incorporate that thing. So with what I do, it's not just focusing on women's health. It's really just the entire body. It's really a wholeness,
Mhm.
or holistic approach that I have to take, which I think with any physician, which I'm not a physician, let me
Mhm.
clarify that, but with a physician, I think it's really important to take that approach because it goes back to the why. A lot of times the symptom, how it might be coming out with a heavy menstruation, it might be connected to something else. So just taking a holistic approach to that individual person is how I usually approach everything.
And that holistic approach is actually over and over and over in the Bible talks about being whole. Because when we're not completely whole, mind, body, and soul, we're going to have symptoms and things show up in different areas of our body. And we're trying to figure out maybe one part of it, but it's because it's not a whole, meaning that it could be stress related. Some things are stress related because it begins in the mind, and so sometimes our mind is dictating how the body is responding to various things as well. We know that, and then sometimes it's just really any conflict within our spirit. It could just be, I'm going to use the word maybe unforgiveness or just unsettledness, in our spirits. It can actually have the body respond in a certain way. And I like that you said that you really need to know what is your goal. Yes, we want to be whole, but really, what are you trying to accomplish? And one thing that I heard you say very clearly is once you start the journey, in order to stay whole, you need to stay on the journey. Because many times we start to feeling better and we feel great. And we go right back to how we were. And those symptoms may reappear. What do you have to say about that?
I think you're absolutely right. It's a lifestyle. And I think I, I, I think you see it all over. It's a global thing now, but I think it's really an American issue.
Mm-hmm.
When you go to countries that their lifestyles are cultural or traditional, you don't see certain things as much as you see here. And we're so people don't people don't like change,
Mm-hmm.
and here, because a lot of us, even if we have family that has come over to this country, we're now incorporating the American way of doing things, right? Is pretty much do what feels good, do what you want. There's no real tradition or culture, if that makes sense.
That does make sense.
um and so, like, how people approach their health nowadays is, well, my grandparents did it,
Mm-hmm.
but your grandparents' lifestyle was completely different than yours, right? And so you have to understand the things that are working against you and working for you, and you have to work with those things in the present.
Yes.
And you're starting it, you're thinking you're good. It's kind of like antibiotics,
Mm-hmm.
right? So you're starting to feel better, then you stop, and then you're wondering, like, why am I feeling sick again? Well, you didn't even complete the cycle of antibiotics that was prescribed to you. Your lifestyle is the same thing, right? It's a continuous journey that you stay on. And once you deviate, then you might start seeing something happen. Or the diet. You're doing really well, you lose all this weight, and you're like, oh, I can have one sweet. And then that one sweet turns to, okay, I can have one sweet once a month. And then all of a sudden you gain 5 pounds. And you're like, wait a minute, but it's a lifestyle.
Yes. And I believe that the discipline that you're talking about, because many times we feel like we can do what we want without having the consequences of what we've done. And
Absolutely.
so, the Bible talks about us being fearfully and wonderfully made. And I think what you've done in your profession is you've actually learned about this fearful and wonderfully made body and kind of able to really talk with individuals one on one and really understand what are your symptoms and why are we having those symptoms. And sometimes it's just a matter of understanding, are we adopting the practices of our parents, our grandparents? And maybe for them, it didn't have the same effect.
Mm-hmm.
For us, it may have a different effect simply because the foods, the quality of foods, the richness of the soil, a lot of things have changed since our grandparents used to, maybe plant the greens or the vegetables in the backyard. They're
And they
not,
were also more mobile than
yeah,
us.
yeah, they're moving.
We live a very sedentary life in comparison to them.
Yes. So
Yeah.
those are things that I think, that we have to take in consideration when we're talking about women's health, that the woman has to be a whole person, number one, but how she gets to that point is by defining, if you will, in advance, why do I want to be whole and what do I want to do? What am I willing to do to become whole? In my mind, in my body, in my soul. So give me an example, maybe someone who you've helped from point A to point B and they have seen some really amazing results.
Sure. This one's actually my favorite.
Mhm.
Another service that I have provided before is steaming,
Okay.
vaginal steaming. I had a young lady who, I don't remember her age. I know she was in her early to mid 30s at the time. She had just remarried, so this was her second marriage. Her now husband didn't have any kids, but she had kids from her prior marriage, and they had been trying for over a year to get married. And so, of course, there's always like a checklist of all the things um, that I look for, that we discuss, because everything is it. Your lifestyle consists of different things, right? Your foods, your spiritual life, your social life. Just there's different parts of your lifestyle, and in the food department, she checked off really well based off of what she shared. But one thing that I always encourage people to do is get blood work done, because at that point we can actually see what we're working with. because sometimes we're doing too much trying to figure it out, or we're doing the wrong things because we think this is what we're supposed to do because we went to Dr. Google, right? And then we freaked ourselves out. But what do your numbers look like? What exactly are we working against? So one of the main things that we incorporated into her lifestyle was steaming. It's a controversial topic. Not everybody supports it, believes in it. They think it might be cuckoo, but it's something that's been done for thousands of years all over the world. And so if you are a huge proponent of Western medicine, you may not see any truth in it. However, this is what the approach that she was open to taking, and we did it. And within 3 months, yeah, her baby she's over a year now. She had a little girl and her husband. And there was a running joke between she and I. Her friends were like, yeah, I'm not coming to her because I don't want any babies. Right. But that to me was really beautiful because, imagine wanting to start a family with your now partner and you're having a hard time. And it's not that easy for everybody because sometimes there are real issues that I'm not the person that you need. Right. And I won't necessarily be of any help to you. However, that to me was just really beautiful because there's a lot of women, especially women that look like you and I, that are struggling with fertility issues. And it's mainly based around lifestyle. So that's one of my favorite stories.
I love that story because you actually met the need of that individual. She wanted to have babies and you were able to work through that assessment of saying, what are you eating? What is your social life like? Let's try this and see whether or not we can actually help you on that journey. And it wasn't until you tried that with her and she was open. And I think that having an open
Yes.
mind, I think having an open mind to maybe non-traditional things. Sometimes they'll say, let's take you in for a DNC, let's do this, let's do that. All those things may be appropriate, but if there's some ways, maybe non-invasive things that can be done that are more natural, I think that that's where we want to start with the least invasive. Maybe it's not conventional that
Yes.
everybody's doing it, but again, there's no harm in actually trying on that, going down that pathway to see if we can get the body to respond, to be stimulated, to heal. Because sometimes there's healing that has to go on within the body in order for it to function as we want to function.
There you go. The healing. A lot of people try to skip that part.
Yeah.
And that's where it starts, is in the healing. Absolutely.
So Antoinette, we've actually talked a lot about women's health and you have a wealth of knowledge. And as I've spoken with you before, there's just so many topics around women's health. That's why we call it the wonders of women's health, because it is we're fearfully and wonderfully made, but at the same time, there's so many things that are a mystery. We don't know why this is happening to our body when we get a
Yes.
certain age. Even I think, sometimes women don't begin to think about children until they're married, but they really should begin to think about that much early on of how they're caring for their body. I remember as a young lady, and there was an older lady in the church, and she's like, don't wear those real high shoes. And, because of the way it affects the body and tilts the uterus and affects the body, but all those are the cute things that everybody wants to do. And, and even just simple things as sometimes the perfumes and the things that we use on our body actually is being absorbed into our skin, which is the largest organ. And it can also be affecting and interrupters of our hormones, I know. So I
Yes.
think there's a lot of things that I know that you have knowledge and you have skill that I would absolutely love you to share more. But before we end today, I would love for you to say, what would you say to the women out there who their health right now is a mystery to them? They can't understand it, whether they're young or at menopause or premenopause, or, many times these open conversations do not happen because
Mm-hmm.
women have learned not to speak. And I think that that is probably to our detriment because there's sometimes that we can help someone who may be experiencing some of the same things that we're experiencing. And we've learned the solution, but it
Yeah.
hasn't been shared. And so that's really one of the main purposes of this conversation, to say, let's get it out into the open about the wonders of women's health. Tell me, what would be your closing remarks as far as women's health? What would be their call to action, if you will?
Um, I would say consider the younger you.
Mm,
What conversations would you have with her? Because the things that you have experienced or you are experiencing, someone else is. We always think that we're struggling by ourselves, or we're just the only person dealing with this one thing. But time and time again, we've seen that there are many people whose struggle looks exactly like ours. So think about the younger you, and being open and transparent and vulnerable. You can save that person from all of the stuff that you're going through. And that's how I think about it. Because unfortunately, a lot of times, if we're uncomfortable having those conversations with our parents, our sisters, our aunts, we're not having those conversations with the doctors. And the doctors aren't going to ask you those in-depth questions. That's the unfortunate part. They'll ask just the basics to make sure they're covering the surface of wellness, and that's where it ends. And so you continue struggling. And then when they do answer those questions, there's usually one solution. And I think most of us have been asked if we were interested in the pill. Like, the pill has been like you have a heavy period, pill. You have an acne, pill. Oh, you're going through menopause, a little dry, pill. Like, the pill is everything, right? Which we know is not true. So I just think about the younger you. How would you want someone to tend to your needs and be open? Like, we're all going through it. We all have the same body parts. Be open. There's nothing to fear. There really isn't. When it comes down to, I don't like the way I might smell, I don't like the way I might look. Oh, that's another thing, which is controversial, because I think a lot of times when we're thinking about women's health, we think sexual, and it's not sexual. It's your body. But what do you look like? Do you know how many women don't even know if they're dealing with some kind of cancer because they don't know that they have a new lesion, right? These are things that are really serious, and you're seeing it in older women, especially with that. There's a lesion, but you've never looked at yourself. Or even when you take a shower or take a bath, we've been taught to use a washcloth, and there's nothing wrong with that, but we know washcloths, even when washed, hold a lot of bacteria. So you don't even know, like, if you were to clean yourself with your hand, this feels different. There's like a little nodule here. It's just really important to know yourself. Just like, if your hair isn't growing in right, if oh, I have this new bump, like, where did I get this bruise? Did I hit myself? Like, you need to know your entire body. So it's just really important for the older generation, or even my generation, to have these candid conversations, because I think at that point it lets the younger women know there's nothing to be ashamed of. God built us this way. Why would he build us this way for us to be ashamed? There's no shame in the way we were created, and I think that's really important for women to understand. There's no shame in the way that we're created. So be open.
I really appreciate you saying there is no shame. And I think that will be the clear message that we would want to share with women today, is know your body. Know your body better than anybody else knows your body. Know when there are changes with your body. Know how to seek help when there's changes with the body. Because the other side of that is, we may notice a change, but we're fearful to seek out to find out what that change is. And so there's a fear of going to the doctor, and have the doctor taking a look at us. Even though we may have noticed that there's a change, because we don't want anyone to look at our privates or look at our body. But I think by looking at the body, looking in the mirror, connecting with the body, if you're putting on any type of, I'll just use an oil or whatever, you can actually feel your skin and actually really feel the texture of the skin, see if there's any difference in the dryness and different things like that. So know your body. I like that. Think of, the younger you. I think that's an important one, because sometimes we think we're so old that no one's paying us any attention, but our body still is very valuable to us. It is very valuable to God. And I like what you said early on. If God put the body part in you, it was put in us for a reason. So we should not just arbitrarily take it out because it may be, I'm going to use the word dysfunctioning, because sometimes we can get it back to functioning well just by simple changes in our diet, exercising, getting adequate rest, even just getting out into the sunlight and really allowing the body to regulate. So
I like what, oh, I'm sorry.
Go ahead.
No, I was going to say rest. I'm glad you brought that up. I actually, it's sitting right here. I got this new book that I'm looking over, Period Repair Manual, right? So I've been going through it. As you can see, there's my highlighter in there. one of the things that I read, which I know that this was important, but they actually said sleep is way more important than exercise.
Wow.
We think we're like, okay, yeah, we know we need to get some rest. You're thinking, oh, I can catch up, which I think most of us should know by now that you can't catch up on sleep. It's one of those things you can't catch up on. You got 3 hours tonight. Okay, I'm going to get 10. It just doesn't work that way. But sleep, that's when your body repairs itself.
Mhm.
At night when you're sleeping is repairing. So that's really, really important to make sure you're getting adequate rest at all stages as a woman. Because I have an aunt, she's in her 70s, and the woman wakes up at 2 o'clock. She starts cleaning. She might take a rest throughout the day. She doesn't get adequate sleep. So I know the older you get, you might not sleep as much. You might nap, which is fine, but rest is really, really important.
Yes. So what this program is just the beginning of many. I want to call her Dr. Antoinette. I know she's not a physician,
I'm not.
but naturally she has a passion for women's health. And when I talk with her and I hear what she's doing for women and making a difference in the lives of so many women, this is a conversation that we will continue to have because it's really important that we are able to educate our women on how they can care for their body and to be their very best self. And if you're your best self, then you can be the best self for your daughter or for your husband or for your spouse. You can be the best self. But I think sometimes
Yes.
we're waiting until that next step, until we have children or until we get married, until. But we want to be our best self so that we can feel our best, function at our best, think at our best, everything and be our very best that we can be. Antoinette, thank you so very much for joining me today. I look forward to when we do our live presentation so we can have women write in on their questions and ask questions. But what I would say to women today is after hearing this presentation, think of one thing that you can do differently that can actually jumpstart your body, whether it's getting them more rest, whether it's buying organic foods, whether it's drinking more water, or even just exercising. Think of yourself. And I would probably add to that is being a must do for all of us is when we take a shower, pay attention to our body. Pay attention to your body. How is it functioning? And make sure that you know every lump, every hump, everything in it. So if there's anything different that you can take immediate action to get it corrected, because the longer you wait for some things to happen, it doesn't always go away. Many times it progresses and gets worse. So thank you for joining us today. It is our goal, it is our hope that from Tree of Life Connection, that we not only connect you to your health and your well-being, but we will also connect you to your spirituality and to Christ. Have a blessed day. Until next time.
Thank you for having me,
You
Jennifer.
are welcome. It's been my pleasure.